Officer at Marshfield Clinic Health System. He has previously served as CIO/COO at the Connecticut Department of Corrections, CTO and co-founder at Health Adventure, and has served in the other senior executive analytics and technology roles. Greg has earned his PhD in health economics from the University of California, Berkeley.
Afternoon. All right, we're going to go on a fun journey. Was going to think about switching things up a little bit. It's a little loud. Is this way loud? Is this way good? Yeah, way loud. I know my kids said I talk very loud, so. All right. Hopefully that's better. Really what I want to get across today is the notion that AI exists, as Qlik had mentioned, as we heard kind of even earlier in our in-depth discussion on R. It's all about influencing behavior, making a decision happen to one extent or another, right? The computer enabling us to arrive at some level of decision. Here's insight, make action in an ideal world. We've kind of gone over what happens when that doesn't happen from Qlik's workflow. So really, that's the intro, right? What's the need for AI? Well, we need it. It helps us really to understand complex pattern recognition. We need it to help us influence some level of thinking or behavior making through the decision process. But that just doesn't really happen in a discrete manner, right? So I've kind of distilled this down into three distinct areas. You've got behavior modification where on your own, if there's an AI bot of some level or some sense, or even yourself with your own natural intelligence, you're self-managing yourself to a decision. I've got to do this. I just put my hand in this 212-degree water, bad idea, I'm pulling it out. Community support for when that fails. You just keep your hand in the water, it's boiling, singeing, flesh is tearing off, it's not good. Friends, groupthink, hey man, get out of that hot water. And when all that fails, and you're like, it's great. Intervention, right? Mass intervention. But these are the ways in which we change. These are the ways in which, at the end of the day, there's some level of behavior modification, and it's distilled down to one of these three categories. And these three categories are pervasive. They're all around us. Earlier today, we heard about Amazon. Kind of the whole basket notion, right? So Amazon's success, integrating recommendations. A lot of other stuff they did, but at the end of the day, we're just addicted. It's like crack. You might like this. You're right, I will like that. Click, buy. Yes. More money. What are we going to do? Amex. Other stuff behind the scenes. Credit card companies, right? The amount of money, when I was doing some of this research, it's amazing the amount of money being poured into this background stuff. We're just going to mine all this data about you, and we're just going to keep subliminally saying, you really need this. I went on a trip last year. It was a really nice trip. My wife did the Formula One race in Monaco. One of these nice, one-of-a-lifetime days, planned it all out, the whole bit. Getting these calls, from Amex. Oh, you also should probably look into this and make this. Yes, you're right, I should. Cha-ching, cha-ching, cha-ching. It's just always behind the scenes. It's pervasive, but it's influencing that level of decision making. Retail, finance. We've got others, right? There's now Alexa behind the scenes, or the other kind of AI bots, trailing and tracking us to the point where now it's just becoming seamlessly integrated. Like when I mentioned early on, me sticking my hand in the water, it's almost like, the old allegory of putting the frog in the water and just slowly turning up the heat, right? Eventually, my dad, I think, he turned 80, actually, last year, or earlier this year. And, I can't imagine a day, back in the 40s or 50s, if you were to have something like this, you'd be like, what is that? Like, even he's looking at this thing now, like, you gotta be kidding me. It's never turned on, my mom doesn't turn on her cell phone, there's just this abject, rejection of technology. Technology that can help. But my 8-year-old, Alexa, dude, like, there's no world that he can even imagine where that type of thing doesn't exist. And now, behind the scenes, Amazon, if you ever look through the massive amount of patents that they've got, we're also having things behind the scenes where, you're just talking, we're having a regular conversation, and when you say the keyword, kind of like, Star Trek, and they're talking, computer. Oh yes, I've already heard what you said, and now I'm going to actually answer you with a response. Alexa, what time is it? Well, based on this other conversation, here's the time, but here's also the date, here's also what you're planning. So all this other stuff, more information, NLP being translated, creating massive data lakes, like the NSA has in their massive compound in Utah, just digitized data, just mining, waiting for to provide some level of insights to somebody. Transportation, yet another, right? Got really cool stuff that's coming out there, from Tesla to Hertz even. Automated driving cars. Elon Musk are going to have, automated fleet for Walmart of just trucks barreling down the highway, delivering your stuff, which is going to be unpacked by robots, given to drones, and dropped off right at your front door. Wonderful, yay, When's it coming? Hopefully tomorrow. But there are so many aspects of this, the human intervention side, the first time, Buddy and I are having this conversation the other day. People die in crashes all the time, people drunk driving, distracted driving, texting driving. But the first time there's one accident, by an AI bot, can't have these things. But again, frog in the boiling water, we'll get there, and then we'll wonder a world in which, how do you, a driver's license? Granddaddy, what's a driver's license? You mean people are allowed to drive? Right? Computers can do things better than us. We'll have to control them. What I want to focus in on today is kind of the healthcare example of this, which is a little discrete microcosm of an idea from an application that I co-founded, we started, we sold it off. Some stuff I can't really tell you about because it's all locked up in IP, but we can tell you about kind of the cooler aspects of this and how the technology worked. And it was all really baked in the idea that there's behavior modification, community support, and intervention programs. But I think Chong earlier was talking about the EMRs. You have these electronic medical records, but gathering all these data, and you go into your physician's office and they're clickety, clickety, clack, 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 go. Yeah. You shouldn't put your hand in that burning water. What are we going to do about this? Here's some medications or whatever. But what we don't know, what was always kind of missing in attempting to do advanced diagnostics and treatments of individuals, is the relevant information from what happens when you leave that physician's office to the time 6 months that you come back, or 2 weeks later, or why do people readmit, within 30 days, and now we're winding up with these fines. We do a good job about capturing really discrete data, again, point of care, here's what I prescribed you, Chong, you're now going to take this medication for the next 30 days, and all we can really do behind the scenes from an analytics perspective is estimate by Chong refilled, so we infer that he took the pills 30 days down the road instead of flush, or I didn't take it, oh, I get a pop-up reminder, I got a refill, let me refill, put this bottle next to the other bottle that I never didn't take. So there's a lot of missing data. And as you know, everybody, that's why we're here, right? The more data we have, the more complete our data, the better our exploratory analysis, the better our confirmatory analysis, and eventually, hopefully, the better actual results. But healthcare in particular, when you're really trying to figure out how do I take care of these patients that have this one rampant disease. They have diabetes, they have metabolic syndrome, they're about to advance maybe into diabetes or into CHF or these other, progressive chronic illnesses. We want to prevent that. Well, how to prevent it? We've got to have the most amount of data possible in order to get the most, predictive power out of our analytics. So we developed something that would enable the tracking and trending of what happened from the time that you left the physician's office and the time you came back. We wanted to kind of work around or enable, through better analysis, how do we influence that behavior so that you're steering away from that continuous negative, those negative triggers that are going to advance your disease. But we can't do that if we don't know what you're doing. Part of the app was around journaling. So, we capture patient experience. There's an app. It's doing a bunch of other stuff behind the scenes, gathering weather variables, as an example, when you're walking around, everything from, the air pressure to temperature to other variables that may or may not play into an interactive effect between the medication you're taking, the food you're ingesting, and the activities you're engaging in. All stuff that we have no idea about. Physicians have no idea about at the point of care. They have no idea what you did in the past 6 months. They just know you came in today, you have this pain. I'm going to diagnose it according to how I know relative to, what the gold standard is for treatment. But all those predecessory things that actually contributed to why you have this pain today, we don't know. So this app was really designed around capturing those types of experiences. You're walking around, you have, a pain. You can just click on part of the body, my pain is here, speak into it, I just have this, radiating pain in my arm, great. We use natural language processing, we distilled that out, did a bunch of other kind of cool stuff with it, get into a little bit of detail later. But it was all really just speech to text. What did you eat today? I had a chicken sandwich with, cucumber. Over time, skip ahead to the results quickly. But over time, we were able to understand that for certain patients, actually with breast cancer, there was an interesting interactive effect between humidity, cucumber, certain type of medication, and presentations to the ED. Actionable information that the clinician researchers could use. More actionable information that the patients themselves could use to say, maybe I should not eat these cucumbers. Seems like a hot, sticky day today, maybe I'll avoid it. Also capturing mood and activities. Again, some of that stuff was captured by IoT devices, glucometers, accelerometers, Fitbit. We can kind of gather all that stuff brought it in. But all this really enabled more patient engagement and influencing behavior through the use of AI, embedded AI in technology. People didn't even realize it was AI, right? There's some gamification, there's a journal recap here, which is kind of difficult to see, but that gives you, so these people that we engaged with before we sold the company, they were actually all multiple types of cancer patients, but they all had either unexplained pain or they were, frequent flyers, basically. They were captured in these cohorts that the clinician research were using. So there was actually a lot of engagement, but there was more engagement that was necessary to be able to provide this discrete information to the clinicians. You had these frequent types of pains, and acid reflux, I had them 6 times. And when did you have it? You click open, boom, we had it on these days. Oh, that's interesting. What also did you do on these days? So the clinician was now set with more information that they could have an interactive discussion on. Maybe you should do this around, your behavior change or what have you. Quick time check. Skip ahead quickly to the aha moments. This was like the fun, glistening AI piece of it all. These aha moments were pushed out to the patients, using the actual app, and they said, you have a headache when you eat pickles, yogurt, you're doing vigorous, aerobic activity within the past 24 hours on X, Y, and Z medication. So actionable information that they could now use, and even if they didn't know what it meant per se, but this information went out to the doctors so that they actually, if the person themselves were motivated to change, because now they're seeing these are the actual things. And again, it's just about massive amounts of continuous data, the right type of data, to gather the right type of pattern analysis to say specifically, here are the things that are or either likely causing or predictive of these types of symptoms that you're having. You don't want to have this pain anymore? Stop doing this. How much time do I have?
A little, over 10 minutes.
Okay, good. I was going to skip ahead, but
16 minutes.
16 minutes, great. I'll have plenty of time for questions. The journal recap again. simple graphs that you're able to pull down, symptoms, food activities, information that the clinician can actively use in better determination instead of that spot, because the provider, you go in, you got your 15-minute slot, maybe 5 minutes of it with the doc, maybe the whole 15, but they're just saying, here's what I see today, here's what I see right now, here's what I see, in your overarching history, here's the medical determination, but it's not really inclusive of what brought me here today. This information actually enabled that. So that was kind of the value. Now, stepping back, all that information, while we were able to give information that was actionable to patients so that they can influence their behavior and stop doing behavior or stop engaging in activities if they chose to, use the information, but stop engaging in activities that led to negative outcomes. We also provided that information to the physicians so that they can make better determinations at the point of care. But also, we were able to create very cool and interesting population health level analytics that were also used because our two clients also happen to have accountable care organizations, so they were actually also very interested, at the end of the day, overarching, unfortunately, everything else, including better information for patients, they care about cost, right? What am I going to do to save all these costs? I've got cost in either fees or I've got cost in my capitation model, which is basically saying, I've got this whole big pot of money, and if nobody comes to see me, that money's all mine. But anytime somebody comes out, $1 out. Tom, you're sick, $1. Man, stop getting sick, right? Well, how do we do that? We gather the most amount of information, and then we create interesting analytics and profiles around the various cohorts so that the accountable care managers, money mongering as they were, could actually understand where we need to pour our resources or what type of triaging do we need to do or interactions do we need to do with certain patients when, where, and why. So we were able to include kind of the whole pop health analytics piece. So our results. At the end of the day, some of the more interesting, there were really 3 types of results that were really interesting. One was we actually were able to show monetary effects, which is why the clients love us, which is why we were able to kind of get a nice multiple and sell. At the end of the day, wonderful. But at a more salient level, kind of really what I cared about we were able to actually show that AI can actually influence patient behavior when you actually are able to present information that makes sense. Not just, super directional, but we were actually able to tell people, and we got interesting feedback through the app. I didn't know, that it was this type of activity, playing tennis, when I was having this medication on these days, that was having, had an effect, and I stopped doing that, and I no longer have this pain. Like, to me, that was like the ultimate win. It was better than the actual check, amazingly enough, on selling the company. Like, having that level of engagement was interesting. We were able to actually show, or our clients were able to show, that increased engagement actually also led to less of a need to write prescriptions. Won't go off kind of a whole tangent about this, but big pharma is big for a reason. They push meds very successfully, very amazing lobbying, amazing marketing, and it's kind of in their best interest to have a lot of medications pushed. And the way that we've time crunched things for providers, medication and prescribing is almost more of a go-to. And it's interesting, as a quick aside, since I have a couple of minutes, last year, 2 years ago, I guess it was actually last year, I was working within the correctional environment. And in prison healthcare, what's very interesting is that there's a lack of supply of providers. So what you wind up having is very, very time-crunched interactions. So patients get maybe 5 or 6 minutes with a provider, a nurse practitioner, or an MD, and they have such little time that the amount of prescriptions is actually higher. You increase the supply or increase the amount of time that a provider can have with patients, the amount of medication, the amount of prescriptions generally tend to go down. This actually showed that the amount of information was enabled enable the providers ultimately to write less scripts and do more direction as to, well, here's the type of behavior modification you need so we can get ahead of this disease state or these issues and get you better on the path to outcomes. We're also able to show increase in physical activity. Again, I think we believe due to the aha moments. And a reduction in unexplained symptoms for a couple of cohorts. Questions? Yeah.
So what do you do when you don't have physician receptivity to this? Because obviously it's a paradigm shift. Some physicians are going to want to adopt a new practice, others are going to be more set in their ways. How do you kind of overcome that?
Right. So there's where we turn to the psychologists and sociologists, and where I back out, not my expertise. So we ran into exactly that question. We ran into two questions actually initially. One was actually patient compliance, so continual use of the app. We were able to solve that actually through the aha moments and through providing that level of interaction. The second, we really didn't have to, we questioned it, but we didn't have to deal with it because our clients were actually clinical researchers. So they themselves led the teams, either themselves, they were actually the physician or the head of the care teams of the other physician and NPs saying, we're going to prescribe the use of the AHA app and you have a level of compliance. But there definitely was at other meetings, particularly at our second client, where a lot of docs were like, yeah, this is great, but I don't see how I possibly have time to to include this. Wonderful. Yeah, I love the analytics. I love what you can get out of it. It's got to be great for somebody else. But we sold it before we had to actually deal with that at scale. But it's a big issue. Yes.
Maybe this isn't the kind of question you're looking for, but I'm thinking, okay, so I put in the app that, I played tennis and had a martini. I always have a martini after tennis. And, the next day I always get a headache, so it's telling me not to do that. Well, maybe it wasn't the tennis or the martini. Maybe there's a tree I'm allergic to at the country club that's causing the issue. So, it seems like you're possibly making some assumptions about causality that aren't necessarily accurate.
That's correct, which is why we never reported it as causality, it was more correlation. But you're absolutely correct. At the end of the day, right, there are so many variables out there. The one random tree at the country club, the best we can do is say, here's a location where this continues to happen. We don't know if it's a tree, we don't know if it's, we don't know what it is. What we do know is that we're gathering more variables into analytics to help to understand what some of the drivers were than ever were captured before. But you're absolutely right. You can never, it'd be very, very difficult until we get to the world of the matrix where AI is controlling us and we're just kind of snapped in, that we can know all the variables of stuff that affect us. And I'm happy for that day. Or for tardigrades to take us over. There's got to be something. Other questions? Okay.
Actually, mine was similar to hers. Given that you sold the company and you kind of moved on,
Right.
the point is, though, you were describing what, and therefore things that you could do so that the what did not happen. But over time, and the larger the cohort, you could get to the why. And that's the goal eventually, right?
That's ultimately the goal. That's correct. Other questions? All right, thanks everyone.